Hey colleagues, it's Bronwyn Cooper here in Sydney, Dr Foot Solutions Clinic and Light Source Health Solutions. I've just got off Kent's fabulous first of three webinars for Heal with Laser, and I'm fired up. I've not been feeling particularly well all day, but anyway, tennis was washed out, so I didn't have to sort of pull out because of the not feeling great. But now I'm all energized and fired up because that's what all this stuff with photobiomodulation and the applications for our patient problems can do for us and for you. So I want to share some things with you because Kent has had a really fantastic session tonight that was very full on. It's very easy when you've got to deliver to a set time and a big agenda to not be able to get back to answer all of the questions. And I want to share some key takeaways that will support your journey in photobiomodulation. So Kent was asked about or touched on growth plates. There was the big thing about the brain, the eyes, etc. Rosie Gosper, you asked about how big a part does laser play in the treatment of Morton's neuroma. Now it depends on your practice. In my practice, I do a lot with correct footwear and no heel height and anatomically properly lasted shoes. And I have a range of brands here. And I find when you put those patients into that shoe, usually they'll say, oh my God, I don't have any pain. My personal feeling is that since I've had these shoes for over 10 years, 11 years, and laser for 9 3/4 years, is that a lot of Morton's neuromas, so-called Morton's neuroma diagnoses, are over-medicalised, as I call it. And I've posted about this in some of the groups. So there's a lot of information about all of this. Generally, I would still do one laser at the first appointment. And often because I'm using a neuromuscular orthotic, you're taking pressure off the ball of the foot as well. All of those things make a huge difference. You heard Kent talk about how laser is only one part of the journey, and that is absolutely so true, absolutely. So I'll also touch on the lymphatic stuff. There were a few questions on as well. And look, Elan in Perth, hello. You asked whether patients were happy about paying a fee for a treatment that might only take a few minutes. Now, the patients are paying us a fee to sort their problem, and the fact that it might take only a few minutes is even better for them. But as Kent said, generally he would still be doing a 25-minute appointment himself. It might be less time if it's a repeat one with his assistant, clinical assistant, that he explained how all of that works very well tonight. So you're not going to get any pushback from any of that. And in my practice, look, after COVID, I started pricing differently and I was a bit too generous, but at the first visit I do charge an extra $80 on top of the initial. And if it's a musculoskeletal like many of you, or chronic pain, neuro, all of that, I will charge $170, sometimes even a bit more. So they're paying the laser at the first visit, but then it's included in the fee. And so when Alana was asking about keeping tab of the stats, I just use the item number off the National Podiatry Fee Code because that's simple. And look, I don't have shockwave here. Many of you might also use shockwave in conjunction with laser. So if you want to differentiate, you would have other ways you could do that, I'm sure. Because in podiatry, item numbers, item F145 refers to rehab therapy. So it's a generic term. Okay, so what I really want to share with you, and I'm going to stand up because my t-shirt, I was ready and dressed for tennis, pause and recover. So that's because I'm involved with an animal shelter and rescue and fostering. But we should also pause and reflect or recover from our huge busy day-to-day whatever. So the PAUSC, pause and reflect. Now, why do I say that? Well, because there's actually so many medical conditions that laser is used for, or photobiomodulation generally. And to be honest, I've been in this space now for, as I said, almost 10 years. Once I discovered the medical, the Association for Medical Applications of Laser and Photobiomodulation and joined, which was in 2017, I have learnt so much more about the medical stuff. And that's the most promising stuff. So I would love to share with you that Professor Margaret Naser of Boston, and look, follow all these people on LinkedIn. Follow Professor Lisa, Lissa, Lasko, Laasko, physiotherapist extraordinaire and a lead researcher in allied health in this area at the Mater in Brisbane. Follow Dr Anne Liebert, also a physio here in Sydney, who presents both of them and many others at international level. So go to LinkedIn and then you'll see a lot more about all of this space, including, and some of you would have done Dr Scott Sigmund's sessions, the orthopaedic surgeon extraordinaire from the States who set up Ortho Laser, one word, ortho as in orthopedics, laser spelt the American way, L-A-Z-E-R. And I had the pleasure of meeting Scott. I've heard him speak a few times via webinars and video links in Australia, but I had the pleasure of meeting him in London at the World Photobiomodulation Congress last August. And there was a great showing there for Laser Worldwide. That's my second World Congress. The first one, and thank you to Heal with Laser, Catherine sponsored me to do in the COVID lockdown of 21. The world one then was in Brazil. And then I presented some clinical cases in London in person at the conference last August. Unfortunately, this year's World Conference was due to be held in Korea and it was cancelled because of the time they needed to go ahead and book the hugely expensive conference centre and everything else in December. There was political unrest in Korea, so the host country didn't feel they could go ahead with that, and I'm guessing it may be held there next year instead. So I want to share with you some stuff about Parkinson's, concussion and strokes, because Kent has been a very busy podiatric surgeon on top of all of those other stuff he does, the injectables, everything else, and is totally dedicated to this space, as many of you know. But I think out of those of us using an MLS for some time, I'm probably the one that's had the greatest attendance at AMPA, which is medical events as well, or medical topics, not just MSK, not just nerve pain, not just lymphedema, you name it. So in answer to someone's query, look, about the brain, they're actually using laser to treat the brain in even long-standing stroke patients. Now that was covered at the last AMPA seminar I was at in person. Was it November here in Sydney last year, I think, with some quite good, very good results, in fact. Did I mention earlier Professor Margaret Naser, N-A-E-S-E-R, of Boston? Now she has spoken a few times on chronic brain, traumatic brain encephalopathy, otherwise known as concussion, which, as we all know, is a huge factor in sports nowadays, contact sports, huge. And have a look at her work. So follow her on LinkedIn, go and check it all out. And you know, you can get the articles about all of this stuff. So why am I suggesting you do that when you might say, oh, but I'm a podiatrist or a physio or whatever? Well, the thing is that actually the applications for a lot of these medical conditions, whether it's Parkinson's, and Dr. Anne Liebert and the other people's work on Parkinson's has shown the very good effects on the Parkinsonian symptoms. I mean, there's still nothing to diagnose Parkinson's other than the clinical scenario. There's no tests. So surprise, surprise, you know, there's no actual treatment for the Parkinson's itself. But you can make huge, huge, huge improvements into the quality of life of these people. And at the moment, the uptake into medical fraternity of PBM is lower than it is into we hands-on therapists. Now, concussion, therefore, I've touched on. Look, a good tip when somebody asked Kent about how close you could go to the eyes, he mentioned sleep masks. If you think about it, if it doesn't particularly go well through clothing, pretend this is a sleep mask and you could put that on, and I would put it on under the glasses. But if I'm doing a toothache or a sinus or something, you don't want to point it up that way, you want to point it down away from the eyes with your handheld diode. And of course you want to use the appropriate dosage. But what I use in my practice is and the women will know, the round white eye makeup remover pads, and I will often have the patient lying and put those on their eyes, and then the protective eyewear goggles over the top. So you're really doing a sort of a, double insurance there, as it were. And yes, toothache. Kent mentioned tonight tinnitus, I think, earlier. Yep, great, can be great for that. I haven't treated tinnitus myself. I've told a few patients, but at the end of the day, we have to respect those patients and their views, even though some of them are in total chronic pain anyway. If it's a less complicated case, they may well want to go ahead with all of that. It depends on you. Now, Sarah asked about whether to massage into the lymphedema. And I can't specifically answer that question, but the bottom line is, an experienced clinician like Sarah and myself know, is always apply your clinical common sense. So thing is, though, you can't just apply it locally. You need to treat, and Kent alluded to the fact that the lymphatics, for example, and the lymphatics, up in the groin. If with some ladies he's a bit sort of reluctant, but at the end of the day, I don't find those sort of things are usually a problem. As I say to people, you see more bum crack, frankly, on TV at night than you see, in the clinic. And if you have an appropriate towel or a sarong or something, you can, use that appropriately and drape it into the area. But those of you that have done any work with the wonderful Kate Perkins of Onco Laser, OT, who has a few MLS lasers now, and it's only one part of her treatment, of course, compression garments and everything, but also the physio extraordinaire in Sharon Tilley in South Australia, in Adelaide, who's presented on this for a very long time. You would be treating, and that's me touching my abdomen, your abdominal lymphatics for those sort of people. So you've got to think globally and not just locally. Just on that point, Sarah, those of you that did a session with Pavle Kurik, who's with his partner, the chiropractor, Lindy, has, is it Balanced for Life, Chiro at Castle Hill in Sydney? Pavle actually has talked about using using the head and literally for the handheld, sort of doing a bit of mobilising of tissue at the same time. I can't answer the question as to whether you would do that with the lymphatics for lymphoedema. I'm guessing not. You would use gentle pressure, I think. Others would be able to answer that. Now, Kent also said he doesn't use this over growth plates, but I do, and I treat those kids very successfully with things like, Osgood Schlatters is, of course, the tibial tubercle, not Haglund's deformity, oh God, brain dead, at the back of the heel. So I find, in conjunction with using a temporary heel raise and often some kinesio taping and wear an appropriate orthotic, but I use nearly always a neuromuscular activation orthotic, and it's different as light is to shockwave. So those kids, I find I've never had to do more than 2 treatments. And when someone asked this question once at an AMPA seminar, and Dr. Roberta Chow didn't have a specific answer, because I'm guessing she doesn't see a lot of kids. She actually sees a lot of really chronic and complex pain in adults. So I made a comment from the floor and said, look, I do use it, and I find that you don't need to use 4 treatments and all that. So you're reducing the treatment time because you're using the other treatments in conjunction, elevating the heel like you're taking the pull off the Achilles, so Sever's disease or Sever's syndrome, I prefer to call it. In front of kids, I don't like to use the term disease. And all of these adjunct treatments are so important. There was quite a few of the tennis group away the other week, and a lot of women had to play singles against American doubles, against a pair of doubles players at the other end. And some of them weren't used to that, and some were quite fit and some weren't. But they had to play all 3 sets that way. And a number of them ended up, really stiff and sore. So you use it for your delayed onset muscle soreness like that, your DOMS. But one of them's been paying a physio who's not given her a heel lift, doesn't use laser or shockwave, etc. And when she mentioned this at tennis the last time I was playing, I just got her to kneel on the seat with her Achilles relaxed, just did the lateral compression at the sides of the Achilles, pressed down on the top, was still damn sore. But here she is playing 3 tennis sets in the one night without a heel raise. So I actually gave her something out of my shoe that became an impromptu heel raise, and she said, oh my God, that's a lot better. So don't forget, your laser treatment can perform miracles, but you'll get those sort of miraculous results more quickly if you're using it in conjunction with other things. Now, I want to share with you that AMPA, and Catherine has supported AMPA long and fully for many years now, are doing their annual seminar here in Sydney on the 22nd of November, including their laser safety course. And relative to the extra questions that Kent didn't have time to address tonight, I want to tell you there is a session on Saturday afternoon. So this is the 22nd and 23rd of November at 4:15, adult and paediatric sports concussion management with PBM. Now, if you're a podiatrist or a physio, you may not choose or want to be obviously treating that area, but believe me, the research is there. And because I eat and breathe this space in the medical scenario a little bit more than your typical clinician, I really want to share that with you to supplement all of the very good information Kent came out tonight. So even on the Sunday then, Dr. Joseph Ryan, the dentist extraordinaire who's been doing research in treating kids with oral mucositis secondary to treatment of cancer of the jaw, etc., and the mouth. He's also now was going ahead with running that here in Sydney at Royal North Shore Hospital as well. So all of that's there. And look, Sarah and others, Sharon Tilley and I'm guessing another physio, but I don't know, Dashankar Sudan, I don't know that name, but that's great, new people coming along into this field, are discussing the clinical use of PBM and the management of lymphedema on that Sunday afternoon. So that's your AMPA, and there's a safety course on the Saturday for anyone that hasn't done one and wants to. And I would really heartily recommend and support that that be done. So there's also your MSK. Look, there's diabetic and arterial ulcers. There's your experience with using PBM in remote Australian communities, using it for neuralgia, lymphedema, as I said, non-cancer pain and cancer survivors. Because many people forget, a lot of our cancer patients who are under their cancer physicians come in with their absolutely stuffed backs, shocking hip bursitis, foot problems, whatever it is. And, you know, part of their physical recovery and mental well-being is to get them moving and walking and all of those things. So I hope you can see that it's really difficult to cover everything in these sessions. Kent's got another session coming up, and I'm going to put this across to Heal with Laser, and they may decide to use this for you or not. Oh, but the eyes is the other thing. Now, even I don't understand this totally yet, but that's only because I'm so busy I haven't had time to research it. So we all know, but particularly with these higher class lasers, usually anything in a class 2 or above, and our MLS is a class 4, you absolutely do not want to shine them into the eyes or have them reflect off anything and go into the eyes. And remember your nominal ocular hazard distance, so that it's not just people in your room. If I have the curtains open behind me and someone was walking past and the laser beam was directed that way, it pretty much would go out to near the footpath through my front garden here. So there's a difference between your nominal ocular hazard and protecting the eyes. So what we're talking about though is that they're increasingly now using PBM to treat macular degeneration, where clearly they're using it on the eyes themselves. So like, I find that confusing, but it's got to be the appropriate dosage, and I haven't had time to look into it. I'd much rather be dealing with brains, strokes. Does that mean I'd treat the brain? No, but if I had someone who was on their last legs and desperate and asked me to, I absolutely would. And there's a massive literature there, as I said. So do yourselves a favour, have a look. Professor Margaret Naser. Okay, that's enough for me. I just want you to know, and I don't think I've said this in the second take of this little longer video than a little video. The biggest thing for me is you don't get burnt out. You love what you do, what you can deliver to your patients, and it's so easy to do so. I'm not sure that I've said this on this one, but with your lymphedema, with your treatment of edema, straight out edema, you can get a change at the first visit. You can get a change in the swelling. And look, I presented on the ruptured quadriceps in London, and he measured it going off the Velcro straps and how far they went round his leg while he was waiting surgery. And I did a treatment on a Monday night at his home and again on a Tuesday night, and he was having surgery here in Sydney at St Vincent's on the Thursday, and you could see it. We measured it and I presented it in London of the improvement in the contact to the Velcro straps. We were tired. You would have had to really, to scientifically measure that properly, you really would have had to have your rulers and make sure, you know, you were really replicating the same area of the leg. Whereas he sensibly just, we did it off the better alignment of the Velcro straps. I've had patients who've had ruptured Achilles who had them surgically repaired and they haven't seen me till 3 months after. And we've had a huge change in range of movement and the overall feeling of the joint at that visit. I use it also when people have been in a moon boot for any injury, and they'll tell you, even if it's a fractured toe and they've only been in it for 3 weeks, they feel better. The range of movement changes, the foot feels more alive in these instances with a broken toe, and they are super happy. So the other thing that happens is that recently one of my patients that I hadn't seen since about 2012 has got the worst collapsed foot with your midfoot collapse. Pods would know it as a compensated forefoot varus, functioned that way for a long time and done really, really well with prior treatments. But, you know, if they don't come back to see you periodically, we often are then faced with a catastrophe having happened. And when Helen presented at 78 and couldn't stand on one leg, let alone do a single toe raise, because a tib post is totally shot, so she's got that midfoot collapse on that foot, but as well as that, on MRI, the superficial and deep deltoid ligaments on the medial ankle are totally scarred and not functioning. So I, for the first time in my career of 50 years of podiatry, have now done my Ritchie brace for the first time, and the difference in this person, incredible. But at the first visit, I lasered it, taped it, and made orthotic changes, and her swelling actually went down starting at that visit, and this is often the case. So once you know all this, you just have confidence and you get on with it. Now, I'm happy to do a Q&A for anyone anytime. I want this to be a supplementary event to the information you've already gained, because it's so hard to cover everything. And when you're the presenter, as I said, trying to engage with people's questions, very, very difficult. So anyone that wants to ask me anytime on anything can get in touch. And I am pleased to say that this Heal with Laser seminar I was able to promote within a physiotherapist business owners group I'm in, because there's a lot of physios in that group who are asking questions about laser who just don't know anything about it, and some of them want to know more. So I just am keen to help spread the word and get it out there, and as I said earlier, make your lives a joy, because you're helping make your patients' lives a joy. So Wheelon, it's not about the money, it's about the results. And half the time you could charge them 50% more or double and they'd still pay it. All right, so off you go to your patients, start getting into your PBM. And in answer to somebody asking about the Sunshine Coast, Alana Underwood said she's up there. I only put in Pete, now I've gone blank on his name, Pete's name, because I've done some training with him in his clinic, and lovely man. But really, you want to be out there in this space and you want to be attending presentations. Dr. Julia Tyack, chiropractor extraordinaire, has had a Sunshine Coast clinic, as well as her Brisbane clinic. I think it's Wynnum Manly on the northern end. So, you know, if you're involved in all of this, you really know about all these other people and you know where to send people for special expertise. Okay, As Olivia Newton-John used to say, love and light, Olivia. So it's share the light from me, and look forward to seeing you all somewhere soon, hopefully in person.